Mr. Speaker, my supplementary is this. The Health Minister, in his response to the Governor for Eastern Islands, mentioned about gas. And I've read from the newspapers, there's been shortage of gas or oxygen. Shortage of oxygen in Eastern Islands and also in most of the hospitals throughout the country. And also the beds are overcrowding. My supplementary is this, Mr. Speaker. What have you done as the Health Minister to prepare the country for such situation? Where have all the COVID funds gone to? And why are all the hospitals in our provincial hospitals throughout the country and even in the city in Port Moresby is overcrowded? What have you done with those funds? Thank you, Mr. Speaker.
Honourable Minister.
Thank you, Mr. Speaker, and I thank the good opposition leader for his questions. I forgot to mention that last year this government gave $2 million to each district to prepare themselves for COVID-19. To prepare themselves. Yeah, you want me to answer the question, or are you going to keep going?
We have a point of order. Obviously, what's your point of order?
That similar response was done by your Prime Minister, and I've proven that there was no $2 million for the hospitals. You are misleading the Parliament. Where is all the COVID funds for the hospitals? Answer the question. Mr. Speaker, there is no $2 million for awareness. Unfortunately, you are misleading this floor. I'm talking about awareness by the professionals. Professionals, medical teams in the provinces. You know who's carrying out the awareness now? And let me tell you, it's the security forces. Instead of them carrying out awareness, they are abusing our people. They are not trained to carry out awareness. This is not the law and order issue. It is a public health issue, and it calls for hospitals to mobilize itself, Health Minister to mobilize himself, the government to mobilize itself to carry out this awareness, putting the professionals out there, not security forces. It's the fact. Health workers are hiding behind the security forces and they are abusing our people as we speak.
We have a point of order. Honourable Minister, what's your
Mr.
point of
Speaker,
order?
the good opposition leader is saying that our health workers are hiding behind security forces. Our health workers are being used at the front line at the moment, at this moment. They're trying to tend to our people. They're not hiding behind securities. Every message that we send out is not done just from our health workers. They are too busy looking after our people. Tell our opposition leader this. Stop misleading this House. Yesterday, Governor Beldan said, talk about facts. Don't talk about things that will reflect on our people. Our people are dying at this point of time. This type of talking by this opposition leader is showing that he has no concern for our people. Thank you.
Honourable Opposition Leader.
Mr. Speaker, I'm talking facts because it's happening in my own district. It's happening in my district. I'm telling you. You know, the soldiers are belting up my people on the street. That is the fact. That is the fact. Maybe you have not gone to your own district. Mr. Speaker, what happened to the 10 million that was given to Papua New Guinea Biomed, who found a miracle cure? And here we are talking about vaccine. We promoted it. We said these people have found a miracle cure. Where is that miracle cure, Mr. Speaker? We want it because coronavirus is becoming very deadly. Where is the equipment for our health workers, Mr. Minister? Our health workers are not properly protected. If you're talking about protecting our health workers, You go to my district in Vanimo. You go to PHA in Vanimo. There are no proper PPEs in all the hospitals throughout the country. There are no proper facilities in all of the health establishments in the country.
Honorable Opposition Leader, we have another point of order.
Mr. Speaker, again, this is misleading this House. I have statements that show PPE gear going to Vanimo. I can show it to this House. Please do not mislead our people again. Thank you.
Mr. Speaker, how do you justify there is no oxygen in Eastern Islands? How do you justify? That's a fact that they ran out of oxygen because you are not prepared for pandemic. Your freedom.
We have another.
You mean a passing law, not giving freedom, you mean 1 month? We are born with it. So let's respect that. Health Minister, you said vaccination is not the cure. Now you work like go come on top one of something. Sit down easy. Larry me pinch him talk to me. I did not disturb you when you were speaking. Mr. Speaker, we have real issue. We have real issue in our country. The issue is management problem. Health Minister, you are laughing because you cannot manage the health situation in our country. The PHAs have become all powerful. No matter how much money you give to them, they buying vehicles, hire cars. No money is going into the hospitals. No money is going to the medicines. In Vanimo, they are writing prescriptions. Citizens are going to buy medicine at the pharmacy. What are you doing as the health minister, Mr. Speaker? Let's come up and talk about reality. You're talking about facts. I'm telling you the facts. Wake up. Go and visit the provinces. Stop sleeping and running around in Mosby only.
Minister, what's your point of order?
The opposition leader is again lying about things. I've been to Vanimo. I've gone and visited the Elias Kapavori building, the Patrick Pruach building. I've gone right through the whole hospital. I've been around the country. I've seen a lot of things that we want to change. Can you please stop lying on this floor, telling people that we're not doing our work? If we weren't organized, we wouldn't be in this position. We'd have lost more deaths than anything. This government has done everything. That guy over there has done nothing. How many years has he been in this parliament? Can you tell me what government has put into hospitals? Why hasn't he talked about times before when he was in parliament? What did they do to the hospitals? Why are we doing it all now? Because we've seen the need to look after our people. He cannot stand there and lie to this House and this country and say that we haven't done anything. We are putting more into health than any other government. Thank you, Mr. Speaker.
Honorable Opposition Leader.
Well, I cannot speak like him because I was never health minister. That's a problem. So you have visited, but you have not equipped my hospital in Vanimo. Visited is one thing. Properly equipping is another thing. Sorry, my friend, you got to understand and differentiate. Now we have Delta variant. There are more variants coming. And are we going to get vaccination forever? Or is there 2 jabs that we're going to get this it? Health Minister, you need to tell us. If there are more variants, maybe let's put it this way. We have COVID-19, maybe we have COVID-20. Tomorrow we have, today we have COVID-21. And tomorrow we have 22. Are we going to get vaccination forever? You got to tell us. I'm sure you don't know. Because you are not a doctor. That's a problem. Having you as the health minister when you are not a doctor, Mr. Speaker.